When a patient is diagnosed with melanoma, a sentinel lymph node biopsy is performed to determine if the melanoma has spread to regional lymph nodes. The single most important indicator determining overall survival of patients diagnosed with melanoma is whether or not the cancer has spread to the regional lymph nodes draining the primary tumor. The status of the regional lymph nodes is an important factor in deciding the appropriate treatment. Our story begins in the lymphatic system. Our body contains two separate systems for transporting fluids: the circulatory system for blood and the lymphatic system for lymph fluid and lymphocytes. The lymphatic system serves many functions, including the initiation of immune responses, fluid transport, and the filtration of foreign material such as bacteria. The lymphatic system is also where cancer cells can drain and collect. If found here, it is an indication that cancer cells have spread elsewhere in the body. If a patient is diagnosed with cancer, it is important to know if the cancer has spread beyond the location where the cancer originally developed. Lymphatic fluid bathes various systems of the body and then drains through lymphatic channels directly into one or more lymph nodes. The sentinel lymph node is the first node encountered by the lymphatic channel draining the tumor. A lymphoscintigram or lymphoscintigraphy is one technique used to identify the sentinel lymph node. This procedure is performed by a radiologist or nuclear medicine doctor prior to surgery using a radiopharmaceutical. The doctor or technologist injects the radiopharmaceutical into the layers of the skin in and around the site of the melanoma. Once injected, the radiologist will take an image of the patient to determine where the sentinel lymph node is located. The amount of radiation exposure is minimal and safe, both for the patient and other people in close proximity to the patient. After the radiopharmaceutical is administered, a dye will be injected. The dye flows through the lymphatic system into the sentinel lymph node the same way as the radiopharmaceutical. The surgeon will scan the patient's body in the region of the sentinel node using a device such as the Neoprobe gamma detection system to detect the site of radioactivity. This indicates where the radiopharmaceutical has collected and indicates the location of the sentinel lymph node. The gamma detection device makes an audible sound when it detects the radioactivity in the sentinel lymph node. The surgeon makes an incision overlying the sentinel node as marked by the indelible ink and guided by the handheld gamma detection device. The surgeon then inserts the tip of the gamma detection probe into the incision to more precisely locate the targeted sentinel lymph node, guided by the device screen and the device's audible tone. Blue dye can be an additional visual guide to ensure the targeted lymph node is found and removed. The surgeon surgically removes the sentinel lymph node, often using the probe to do one final check that the targeted lymph nodes have been removed. The removed lymph nodes are sent to the pathology department for examination. This examination confirms whether or not cancer cells are in the lymph nodes. This is important in determining the appropriate treatment of the patient's cancer.